Even after Wajir's second governor was impeached for failing to manage the health sector, no change has been witnessed in Wajir Referral Hospital. For about a month now, the hospital's backup generator has been utterly malfunctional, and this forced nurses to attend to patients using torches due to power outage.
To a workstation where patients are buying normal saline for themselves. A workstation where patients are buying gloves for themselves. Yeah? A workstation where blood, a very important product, a very important life-saving product, has to go bad because there is no electricity. Every time you ask, you're told the generator is going to be procured. So how long? How many people have to die? Yeah, so that the county government of Wajir buys a generator, a backup generator for the hospital.
I'm a witness. 2 nights ago, my daughter was delivered at that hospital. I was there personally. Maghrib time, there was a blackout. The nurses were using their phones for delivery. My question is, if a nurse is using a torch, if there's no backup generator, if the only dependence is Wajir power lighting, and you see the situation in Wajir, the KPLC, that is pathetic. It's from bad to worse. And we want to condemn that there's no performance in this hospital. We want to tell the county government of Wajir to close that hospital because there's nothing.
All wards remain dysfunctional. We meet this mother from Burder, Wajir South. Her niece is undergoing excessive postnatal bleeding. Unfortunately, the hospital's power is off. She sent somewhere else for help.
Burder Hospital.
Member of County Assembly from Wajir ward, the ward which we are in, which the hospital is situated, the main hospital. The hospital is completely down, and I'm calling the governor and the people who are working in the hospital to close the hospital, because there is nothing that is going on in the hospital. There is lack of reagents in the lab. There is lack of water in the hospital. There is no electricity. The entire hospital is in shutdown. I'm calling upon the governor and the finance team to close the hospital if they are not financing the hospital.
Sasa hapa hospitali hii ni giza. Hakuna mtu anafanya operation, hakuna mtu kusalishwa, hakuna sitima, hakuna popote. Na serikali iko wapi? Sisi tunaulizana kama ni wananchi. Sisi tunaulizana serikali iko wapi? Na ilisemekana wale habarufa kubwa iko hapa. Anasema serikali iko. Na sisi hapa naona serikali wananchi anakufa. Sitima hakuna, hakuna maji, hakuna bali ya kusafisha na luka kama kitu kingine. Sisi nataka tafadhali serikali ya juu akuja angalia county.
Health workers in the hospital now term the hospital situation deplorable. People of Wajir County expected much from Ahmed Ali Mukhtar, who promised to clear all the mess and leave no stone unturned 7 months ago when he was sworn in.
Babies dying in the NBU, they died because there was no electricity. That is not our fault. We cannot do anything about it. Yeah? But healthcare workers have been so consistent in terms of working in conditions that are very deplorable. Yeah? And we will continue serving services in such conditions.
Nothing comes before health in human's life. Good health is a priority in everyone's life, except for the people of Wajir who never have the privilege. For quite some years, people in this region fought battles in the name of power outage and poor health sector. Now the question still remains, for how long will they narrate the same narrative? Under whose regime will this dark chapter be closed? Quresha Ali, Alpha TV, Wajir County.